So good afternoon. We shall be taking you through the National Emergency Response Committee on Coronavirus, an update on the current country response measures as at 21st April 2020. This is day 40 of our country's response, and this is our 35th brief. Fellow Kenyans, coronavirus has continued to cause destruction in every part of the world. As of today, the global COVID-19 pandemic cases stand in excess of 2.5 million, with approximately 600,000 recoveries and 170,000 deaths. Here at home, the numbers have been rising every day. Even in these times, we still have cynical Kenyans who hold the view that this disease is not real. This is very disturbing, particularly in light of the growing numbers of people who are infected. As we continue this fight, we note that there are some of us who continue to disobey the measures and regulations announced by the government. I would like to remind you that we are in a war situation against an enemy that is not a respecter of age, status, gender, race, and religion. Some of our young people are deliberately breaking curfew regulations due to the false belief that they cannot catch this disease. And we would like to remind you young people, including myself, that we are actually able and susceptible to get this disease. In the early days, we cautioned you on surfaces that are likely to be contaminated in the aid of the transmission of this virus. Among such surfaces include groceries in supermarkets. We would like to acknowledge efforts made by many outlet stores by providing sanitizers to shoppers and ensuring that no shopper is allowed into a shop without wearing a face mask. However, we are concerned that it is important that cashiers handle the goods correctly, especially during payment at the counters. These are also areas that can be easily contaminated and that can lead to infections. And therefore, we are urging all supermarkets to devise innovative ways to address this issue. The same should also apply to banks, particularly in the aspect of different people sharing pens in the banking halls. Fellow Kenyans, this is a long journey that we cannot walk alone, and I want to thank all the individuals and corporates who have so far contributed to this containment effort. I particularly want to thank the Kenya Air Force for deploying 2 aircrafts that have been flying banners, aiding in our communication with banners stating that we should stay at home. I would also like to thank our healthcare workers for their continued efforts, and particularly today, where the Kenya Editors Guild Association, together with the Kenya Medical Association and the Association of Nurses, has initiated a campaign dubbed Saa Sita. In this campaign, at midday every Wednesday, we will all stop and clap for all our healthcare workers. And this is a campaign that is being rolled out in different countries across the world. This is to appreciate the role of healthcare workers and the crucial role that they are playing in this time of COVID-19. Let me also acknowledge the contribution of mobile network providers, and in particular, our national carrier Safaricom. Through its foundation and other donations that have come so far, they've contributed close to 10 million Kenya shillings for thermal scanners, and they've also helped us in expanding our screening capability. Additionally, Safaricom will be supporting healthcare workers and is in the process of rolling out a free communication package. This package will include 3 months of internet bundles and airtime for our healthcare workers and will form part of the comprehensive care package for our healthcare workers.